got some improvement there. Around 10 degrees is what you would expect to see. Anything from 10 to 30 degrees is considered normal from a JACS test perspective. Okay, so they're the basic assessments that I think can at least give a little bit of a picture as to whether there is some functional issues occurring in terms of gait. So more often than not, as I said before, around 70 to 80% of the population are going to suffer issues associated with their feet pronating excessively. So you would expect to see scores in this area of around 3 or 4. You'd expect to see most people who've got a foot which is pronating excessively. Now obviously, from a perspective of using the orthotic devices, selecting the appropriate orthotic device is going to be important as well. So I've put a couple of little concepts together here. Although it's not absolute, they should certainly indicate in most cases pronated or supinated feet. In addition, obviously, certain aspects of the analysis will determine the area where the primary dysfunction is occurring. I think if you've got a massive discrepancy between both feet, then I would definitely be looking at leg length, and you're probably going to look at that anyway. So I would assume that that's a relatively regular part of your assessment. So obviously using a heel raise, if there was a need to do that, you could do as well as an adjustment to the orthotic device. And obviously, when we're looking to score here, I've just put a reference point here. If we had a positive navicular drop, a relatively neutral rear foot and calcaneus position, and the JACS test was also positive, the McPaul device would be the way to go. Any other score with +1 through the midfoot as well, would be better to look at the Dannenberg device. And then obviously anything into the negative side of things, we'd look at the Hoke device. So those 3 products really you can almost position to the varying different types of feet. So choosing the right orthotic, looking at the foot analysis score, obviously history, weight activity tolerance makes a big part to it. So obviously our standard product comes in multiple densities. The majority of the new range of product is in the blue density. Tolerance is one of the biggest ones. If people can't tolerate the feel of the device, and I think we had that question asked earlier, if they are too hard, they're going to end up in the top shelf. So having our product as such with multiple densities means that you're going to have a softer top cover that's more forgiving, has the ability to attenuate shock a little bit more effectively, and more than anything else it feels comfortable. You get a comfortable experience out of the products. Footwear type also will determine the appropriate. So when we're fitting the orthotic device, we want to check the shoes that we're looking to utilise the device into. So if I was taking Iggy for example and I'm thinking the orthotic devices, I want to use either something like a 3/4 length device which is doesn't have much of a border to it, so this device here, which is probably what you're wearing, isn't it Iggy?
Yes, that's what I
Yep. So this type of device, because the shoes themselves have a narrow last, so this fits quite effectively into that type of a product as such. Certainly if we're looking to fit out, if the shoe has an inner sole that's removable, I'd always take out the inner sole and replace it with an orthotic device that is full length. Most good shoes these days generally have an inner sole that you can take out. Certainly for fitting the product itself, we want to be able to fit the device so that we can still maintain appropriate range of motion. This is fine. Hopefully it's the same size. Okay. So what I would suggest we do is we just extend all the metatarsals to be able to see what range is available, push the device up against the foot and you should see the same amount of range. You want this to finish, the arch contour to finish about 5 to 10 mil behind the bisection of the first MPJ. If we're fitting out the Vasily Dannenberg device and we want to remove the plugs, same process again. We want to make sure the length of the device is correct firstly. We run our thumb underneath the hallux itself, find where it has its greatest available range, which is generally a couple of millimetres behind the joint, and that's the plug that we want to remove, which in this case would actually be the proximal plug. We take that one out. I'd actually find, because you fit pretty much slap bang in the middle of the two, that we'd spin that around and have it fitted out this way. So this is supporting the surrounding surface of the joint. It actually elevates the hallux just a fraction, so it's going to promote that first MPJ plantar flexing, and obviously by reducing pressure under the hallux we're going to be able to turn the foot more effectively from a really mobile position, which is what we've got here, it's just a big bag of bones, to a more rigid and efficient position to be able to propel forward. Okay? So it's a really useful and simplistic product to be able to work with, which is great. So that's how we go about fitting the product itself. Obviously, if you fit them into the shoes, you'd ask a comfort response. Depending on how they feel from a comfort perspective, we do have the ability to be able to modify the product a little bit. So we have some wedges. You can use heel raisers or rear foot wedges to be able to provide a change in the angle of the rear foot. I actually find these are quite useful. So we have a 2 and a 4 degree post that you can put onto the device to be able to invert the foot a little further, particularly if they were getting arch intolerance to the device. This is a way to be able to put the foot in a position where there's less collapsing through the midfoot. So it is quite easy to use. More often than not, if you've got a shoe which has a reasonable elevation toe to heel, there's not that much of a need to use the rear foot post, particularly initially. I don't think you really need to. I think really a process here would be, we just want to determine whether this is going to be a useful part to treating your patients as such. So we do have some complementary products. So I was mentioning these before. We have recently brought in this new brand which is called Vionic. Vionic is an amalgamation of about 4 or 5 brands from the US. Effectively, I think really when we're talking about the warmer months of the year, of which there are pretty much every month here, this particular product is almost as valuable for you as any orthotic device.
So different than what you guys had here before?
We've had, I think, Orthoheal, the Vasili Medical range, the Delmar, and the...
yeah, that's the one. I had some patients that tried that and was really uncomfortable. Like the strap itself was giving them issues.
Yeah, the straps with this are a little bit thinner and a bit softer underneath the foot, so there's a few changes in that. The contour to the product is also a little bit different as well, and we've brought in some colours that are a little bit more attractive, which I think... The pink? That's okay. It's very metro, very metro, yeah. So look, from a technology perspective, similar idea. We have a... Well, no, I'm not going to go there. Need small socks. But nice deep heel cup. They have a 4 degree angle, so less of a rear foot angle built into this. It does have a much greater bulk of EVA, which is our primary material that we utilise with this product.
Orthotics are 6?
Yeah, they're at a 6 degree. So to take into account compression of the materials to in and around 4 degrees. So this uses a 4 degree angle in the rear foot. Still tapers nicely through the midfoot and forefoot. We have the softer neoprene material on the inner lining. They come with a 30-day comfort guarantee, which is, I guess, a good platform also to utilise with the orthotic devices. When we're looking to wear the product in, I would generally suggest a couple of hours at a time.
There's a guy's version on this, not the little shiny.
There is a men's version coming. Yes.
Jeff wants this one.
I thought this might be better suited the strap over. So
this is Dr. Bell.
It's pretty attractive, isn't it? So there is a men's range that is coming soon, but as we were discussing before, I guess from the perspective of those that purchase footwear regularly, ladies are probably a slightly higher percentage than us gentlemen, so we've worked on that scale to start off with. But I think really where we look at this product is this is really something we drive as a first thing in the morning, after sport, after work product. I guess really the presentation I did yesterday with the chiropractic assistants, they should be the ones that are effectively driving this with a basic referral from you guys. That would be the process that I would be sort of suggesting to work on. If you've identified that they might need something from an orthotic perspective, yes, obviously the orthotics will be valuable, but I think there's some real value in using this in times when you haven't got an orthotic device on. Okay. Lifespan, generally 12 months. They do last exceedingly well too. And they are something that we get a lot of repeat business for. So we have an enhanced range of this that we have at the moment at Takashimaya. So we've actually got a little section in that shopping centre as such that is dedicated to the Vionic product. As I said before, it does have a footbed that has been clinically proven to be able to reduce internal tibial rotation and excess pronation. So as I said, we'll get you the details of all of those too if you want to have a look-see. But it's the only product from a footwear perspective worldwide that offers this type of technology, which is really exciting. It's a great point of difference on any other footwear, which is nice for us to be able to work with. But obviously for you, it does give the ability to have something in the clinic that's an adjunct to standard sort of orthotic-based treatment. Around $100 to $150 is the pricing point with those. Oh, I'm just running over time. We also, look, we have some compression-based products. Look, I understand that sometimes compression therapy can be a little bit question mark, and I guess from when we're looking at the structural side of things, compression therapy isn't going to do a dramatic amount in terms of helping out structure, but what the compression products that we do have are focused on is really helping out with managing swelling, and obviously swelling in general is going to lead to pain. So if we can reduce swelling in and around a joint and around an area as such, take the pain away from that area, the ability for it to function more effectively obviously enhances. So this product, which is called the FS6, if anyone does want to try it on, I would suggest you do so. It's quite a comfortable little product. Sorry, my slideshow has just gone to the wayside, but there is one actually which is your size, which is good. So I've got a couple in the large size there. They come in 4 sizes, 3 different colours. This is another one if you want to have a bit of a look-see at it.
This is more for diabetic patients, is it?
No. This is very much for the likes of patients who may have plantar fasciitis. Yeah, it's really targeted at plantar fasciitis more than anything else. So I guess how this is designed to work is we have 6 zones of compression. We have light compression at both of the ends. We have a high level compression that sits just under the, in behind the metatarsal heads and surrounding the calcaneus. So from a compression perspective, all it really does is it reduces the foot from the plantar fascia from elongating, particularly when you're going from a rested position to an active position, which typically with that type of a problem tends to be a big issue, first thing in the morning in particular. So these actually work really effectively as a night splint, very effectively to be used in conjunction with varying different types of activities, particularly those activities where you can't get an orthotic device in the environment, so minimalist running shoes, ballet, dancing, so on and so forth, where having something that at least provides compression to manage swelling in the area can at least help reduce a little bit of pain. So ankle sprains, like I said, stress in terms of the ankle area. It's been okay with Achilles problems as well, but particularly heel pain is really where this one is driven. And then we have some products that are targeting varying other areas as well. We actually do a calf sleeve too, which again certainly is, it's like a compression stocking, so we have high compression at the ankle area and it graduates up towards the calf, and it has a targeted zone for the Achilles and calf area as well. But the foot sleeve for us has really been a product that we've had tremendous success with. It's the most popular product we've ever had.
Can you build this stuff? You had a lift and just a lift on, because I got a patient that had like a hip replacement.
Yes. Yeah. Technically, you probably could. We've actually looked at it before.
You don't have it?
Not at the moment, no, not at the moment. But I can see the value in doing that. I've actually had someone that has put a heel raiser inside and then put that over the top of it so that they could use it into varying different types of shoes, which has worked quite well. Not yet. We offer the heel raisers, so we do our standard sort of.
Oh, you do? Okay.
Yeah. So we do 4, 6 and 8 millimeter heel raisers, 3 lengths to them as well.
But you can't add. You can't just glue this to the bottom of the orthotic?
Yeah, absolutely.
Well, that's what I'm saying.
Yeah. No problems. Sorry.
That's all right. It's probably my accent.
No, that's okay. All right. So yes, these can definitely be.
The only American around, so nobody can understand this.
I'll have to get used to it. I'm over in the States in 2.5 weeks' time for a month. So, but yes, definitely can be applied.
All right. So you just take the basic.
Yep.
Just add it in?
Yep, just add it in. Obviously, I guess with this, you've got to be a little bit conscious of the space that you've got to work with as well, and also the elevation that the shoe provides. So if you've got a reasonable elevation in the shoe, depends on how you're trying to achieve that sort of elevation and lift. But 4, 6 and 8 millimeter you can apply to each of these if you want to be able to balance out a foot relatively well.
What if you do the analysis and they don't need the orthotic itself? Can you just throw these in the shoe?
Of course you can. Absolutely. Yep, absolutely.
Or are you just reverse it around?
Just reverse it the other way around and just adhere it straight to the bottom of the shoe.
These are cheap, right?
Yeah, they are. Yeah, there's a couple of, like we have a box of 10 or 12 of them for a nominal cost. So, yeah, absolutely. So yes, plenty of little modifications that could be done. But thank you very much for your time, folks. Hopefully there was a couple of things in there that were valuable for you and gave at least a bit of an overview about how we want to try and tackle some of this orthotic stuff in-house.
Can you send the slides?
Yeah, we'll send it over.
Done. You'll have all of that.
Thank you for your time.
That's okay, no problems at all.
It's more of like an informative session. We're not expecting the doctors to have to go through the entire analysis. It's more for you to know, to be able to like identify, what we believe that will benefit our patients as well. So what is going to happen next going on, moving forward, is we're going to give you marketing collaterals. We're going to be setting up the visual merchandising for the new range of series. We'll come in and talk to you about it as well to get some feedback on the items themselves, so you can feel it for yourselves. And then we'll send over the price list. And then we'll come up with a referral scheme as well for the footwear. But as you know, we're not selling footwear in the clinics anymore due to stocking and inventory issues. So what we plan to do is to refer them out. So if any of your patients are keen on getting sandals, the new range of sandals, they can actually go down to Takashimaya, which is their retail store.
Yes, level 2.
Get them.
So we're not going to be selling the orthotics in the clinic?
We're going to be selling the insoles in the clinic,
Oh, okay.
but we're not going to stock a lot. So it's going to be a SML for the Signature Series. You see 6 models. And then for any others that the doctors wish to order for the patients, it will be on a per order basis. And it's 24 hours 7 delivery, so it's not an issue.
But the analysis that he taught us, we need to use that.
Yeah, we will incorporate that.
Because otherwise, that's the whole key, is to use the analysis to know which orthotic is appropriate.
Correct.
Yeah, I think it could be useful. I think obviously it takes me 20 minutes to explain it, but to literally perform most of those tasks, a couple of
once
minutes.
you learn it, it's pretty quick.
Simple.
Do you have an orthopaedist who works at the shop, or is it just purely retail?
Just purely retail outlet, yeah. So certainly, obviously they'll understand how to fit the product. It's actually Iggy's sister, so she's got some pretty good technical knowledge, but they'll at least be able to fit the product out. You could obviously reevaluate the product if they brought it back to you, if you needed to do anything else with them. So
Sorry.
yeah, that's fine.
My name's Greg, by the way.
Matt, by the way, yes.
Where are you from?
I'm actually from Australia, from Melbourne originally, now Brisbane. So
Great.
yeah.
Awesome. Do you use these products in podiatrist offices here in New Singapore?
Yeah, certainly some of the podiatry clinics. I think Iggy will have a better knowledge of that. So
Podiatrists, the physios.
That'd be great. Yeah, if you could give me their contact, because I'm just speaking honestly, like this isn't my product, and it's not something I'm going to spend a lot of time investing on. So I'd rather refer them on to someone who's a specialist of the foot, so they can get fitted properly.
Which is fine, and I guess really a lot of this is about confidence in being able to do that. Hopefully, by even evaluating the foot, if you're not confident in dispensing the product, at least you're going to be able to refer more efficiently, which is cool. Hopefully, you might by assessment actually go, you know what, I could probably do some of this myself, and I think that's really where we find it's not like most of the medical professionals that we deal with, it's just confidence more than anything else. And once you get a few patients, you get some positive feedback on it, does become easy to incorporate a product. But if you're happy to refer out, we have plenty of people that you can refer to,
It's
so
just time
that's
and
fine.
energy, right?
Yep.
You know, just putting the time and energy into the
Yep.
product.
That's fine, no problems at all.
Appreciate it.
But the scenario, just real quickly though, so we're going to have like 3 examples in our clinic. If we do an analysis and we determine that we do want to order it, then we just place the order. Then it's delivered to the clinic within 24 hours and then the patient picks it up. But as far as the sandals and things like that we refer out. I get you. Okay.
Yep.
I understand.
If anyone does have any further questions, etc., this is good because I've only got a few people to hand them out to. By all means, just shoot myself or Iggy an email if you've got any tricky patients as well. If I can't answer it myself, I have direct contact with pretty much all of the think tank team, and we can get an answer for you on pretty much any type of an issue. They would have dealt with someone in a similar